My name is Jackson Musuza. I am a second-year internal medicine resident at White River Medical Center in Batesville, Arkansas. The title of my presentation today is Exacerbation of Cold Agglutinin Disease by SARS-CoV-2 Infection. Infection in SARS-CoV-2, the virus that causes COVID-19, has been associated with profound hematologic disease processes, including cold agglutinin disease, which, for brevity, we are abbreviating as CAD here. Several published reports currently are focused on new-onset CAD at the time of diagnosis of COVID-19. Here we present a slightly different scenario of a patient that had pre-existing stable cold agglutinin disease that was exacerbated by SARS-CoV-2 infection. The patient was a 71-year-old male who was admitted with excessive weakness and lightheadedness that were ongoing for 2 days. He reported occasional jaundice but no known history of liver disease. There was no history suggestive of an ongoing acute hemorrhage, such as hematemesis or marina. Review of other systems was unremarkable. Significant history included chronic kidney disease, chronic lymphocytic leukemia, Waldenstrom's macroglobulinemia, and cold agglutinin disease. The patient was following with a hematologist at an outside hospital. In terms of physical examination, he was lethargic and had pallor of the mucous membranes. Vitals were normal, and examination of other systems was unremarkable. He was anemic at admission with a hemoglobin of 5. His baseline was around 8 to 10. White cell count and platelets were slightly reduced. Indirect bilirubin, lactate, dehydrogenase were elevated, and haptoglobin was reduced, all suggestive of an ongoing hemolytic process. Of note, his cold agglutinin titers were very elevated at 1 to 20,000. Direct Coombs test was positive, but it was negative for IgG, ruling out the possibility of coexisting autoimmune hemolytic anemia. Blood smear showed marked anemia, numerous large red blood cells that were clumping, again confirming the presence of cold agglutinin disease. Other red blood cell findings such as fragmentation and row formation were absent. The patient tested positive for SARS-CoV-2 infection, but he did not require supplemental oxygen. In terms of treatment and clinical course, we started the patient on steroids in consultation with hematology, with the understanding that steroids are not very effective in treating cold agglutinin disease. However, there are recent reports that have been published indicating that patients who present this way can quickly deteriorate if no treatment is instituted, including steroids. We also treated the patient with supportive care using folate supplementation and transfusion with packed red blood cells as needed. Erythropoietin was also administered because of the history of chronic kidney disease. Notably, we did not use rituximab for this patient, even though rituximab is known as the first-line treatment for cold agglutinin disease. There's a number of recent reports that have actually indicated that there is increased severe outcomes among COVID-19 patients that have been treated with rituximab. For that reason, we didn't use rituximab for this patient. The patient progressed well. He was discharged with a stable hemoglobin of around 7.2 to start rituximab at least 2 weeks following recovery of this acute process. In terms of discussion, implications, and take-home messages, number 1, we discuss a patient with pre-existing stable cold agglutinin disease that was exacerbated by SARS-CoV-2 infection. Number 2, rituximab, the first-line treatment of cold autoimmune hemolytic anemias, is relatively contraindicated in acute COVID-19. This further complicated management of this patient. This report increases awareness of possible exacerbation of cold agglutinin disease by SARS-CoV-2 infection. And our goal is that providers will be conversant of this and will take this into consideration whenever they see patients presenting in this manner. We have a few important references that we've included, and they can be found in the comment section of this presentation. Thank you for listening to me.